Hi there everyone, it's Randy Murphy with the Mobile County Health Department here with you again to give you our daily update. Have a pile of stuff on the lectern here that I'll get to later. But first let's start with reports on the number of cases. Okay, making sure I have the right paper there. So worldwide, again, over 2 million cases of COVID-19 disease with 138,000, little over 138,000 deaths. The United States is now over 640,000 cases with 26,708 reported deaths. In Alabama, the last time I looked at that dashboard that is at alabamapublichealth.gov, Alabama was reporting 4,249, so 4,249 confirmed cases with 126 reported deaths. And in Mobile County this morning, the real-time dashboard was showing 567 confirmed cases and 12 still who had died from illness. We still have several investigations of people who have passed away that may be related to COVID-19. And I've mentioned previously that this week there has been some ongoing conversation about Alabama maybe changing the way that they are counting COVID cases, or perhaps only reporting one number to hopefully clear up any confusion. There are still ongoing conversations about that, and as we learn more, we'll let you know. I want to mention yesterday, reiterate the health order that came out from our health officer, Dr. Bernard Eicholt. As health officer of Mobile, I strongly recommend all employees and customers have a protective covering over their face when engaged in any and all retail operations. Protect yourself and others as we have increasing cases of the viral illness. This is the quote from our health officer today. Again, the order came out yesterday strongly recommending the use of face coverings for retail workers and retail shoppers. We've heard from one or two large grocery stores that have said that they are going to require face coverings for their employees and shoppers. We think that that's a good move. We've gotten lots and lots of questions about whether or not the health department is going to be able to supply a face mask now that we're asking everyone to wear one. We're not asking everyone to wear a face mask. We're asking everyone to cover their face. So these are examples of face masks that you might see around town. These are medical supplies. Here's another one, a procedure mask. So these are not the things that we're talking about for the general public. These are medical supplies that are in short demand, and we don't want people in the public that are just moving about the community further depleting the supply of face masks. These are face masks. What we are advocating for and strongly recommending by retailers is the use of a face covering. This is a cloth face covering. It was hand sewn. Just slide it over your ears and then make sure that it covers your nose and goes under your chin. And again, this is to protect everyone else from the germs that you may be carrying. So this is something that you use to cover your face, a face covering. I have some other examples here that have been made with materials just lying around the house. This one's pretty nifty because it also has a tie, one of the little metal ties that you use around garbage bags. And with this one, you can actually pinch it around your nose. So I can make sure that that fits tightly around my nose and under my chin. So again, we're asking you to cover your face. This can be done with a handmade mask, or it can be done with supplies that are still, you may have lying around your house or may still be available in some of the stores. This is a bandana that was just purchased today. So if you don't have a face covering, you can cover your face with a bandana, tie it in the back. I think that, my husband gets a kick out of going to the grocery store for us and with a bandana around his face now. If you have in your stash some rubber bands, you can use those. But if you don't have rubber bands, you could even use hair ties. So hair ties are still available out there. So here are just 2 hair ties that I can use. And I'm just going to fold this bandana I know you can't see what I'm doing, but you'll see the payoff. Fold the bandana, put the hair ties around, and now I have myself a face covering with the bandana. And I can stretch it to make sure it covers my nose and goes underneath my chin. So these are the kinds of things that we want you to be doing. This is a dinner napkin that I could make a covering with, also with just a couple of rubber bands, or you can take a t-shirt and take an old t-shirt and cut a piece of the fabric and make a face covering that way. So again, anyone out there can make a proper face covering with whatever supplies you have available. We've seen reports, and these are true. We trust the reports that say if you have the blue shop towels, maybe in your garage or in your shop or in your storage someplace, these can render a plain face covering extremely useful in preventing the spread of droplets. So what you might do is just take your piece of cloth and put one of the towels inside, and then fold your cloth up, put your rubber bands on it, and then wear it around your face. And with that blue piece of towel inside, you get much greater protection to both you spreading your germs, and with the blue cloth, even you breathing in germs from other people. So again, lots of ways that you can make your own face covering. So please get creative, put your kids to work, your grandkids, your nieces and nephews that are out of school, and have them get them to have some fun making you some face coverings. So I want to just give you a little bit more information then about our data. We are holding pretty steady at about 10% of our COVID patients are hospitalized. So again, about 10% of people with known COVID infections are hospitalized. Most of those are in older categories, but we do have some folks, in the 50 to 64 category that are hospitalized. So the good news about that is 90% of you are recovering at home. I get a lot of questions about how many people have recovered from COVID, and that's not a question that we can answer with any certainty right now, because we just don't have the staff to go back and call all 500 of our positive cases to find out how they're doing. We're really focusing on interviewing the people who have newly reported cases, but we will continue to try to get that information and give it to you when we think that the data are good. And we're also holding at about between 2 to 3% of our cases die with COVID-19. That seems pretty steady, along with the other statistics that I generally share. So not much changes with regard to age, sex, race, or zip code. So I will point those out. Yesterday, since the last time I ran my report, there were 52 new cases reported. That was a high for the week. So we'll be watching closely to see if that number continues to rise. And someone from the media asked me to talk a little bit about these two charts. The one at the top is the number of cases that are reported to us each day. And this is sort of affected by when you got your test, what lab ran your test, how quickly they were able to run it, delays in reporting, that sort of thing. So this graph contains data on everybody, but it's just the date that it was reported to public health. So that doesn't always have much biological explanation behind it. The chart on the bottom is for the patients that we know are symptomatic and that we've spoken with. This is the number of cases by the date of symptom onset. So as an epidemiologist, I use this information as a better measure of how quickly the virus is spreading throughout the community, not like the top chart, which is based on when somebody got tested. This illness onset date tells me a little bit more about how long ago did we have people who were symptomatic, and when do our number of cases or transmission in the community start to go up, as we can tell by the number of cases by symptom onset. There's also a bit of a lag, so even though these numbers are low, it doesn't necessarily mean that we're out of the woods. This is just that we have ongoing investigations that haven't been completed yet. So hopefully that it provides some explanation about the difference in those charts. Let's see, illness onset date. All right, so I answered those two questions from Lanyap. So on to some other questions. Let's see, I'm going to save that one. Well, let me make a statement. This was something that our public information officer pulled off of our Facebook page, and this was provided by, just a community member, a viewer, who made this statement. Social distancing is not being followed in my community. I made one trip for meds in the last 2 weeks. It appears there's more traffic now than during the hot summer months. People are not social distancing. More family gatherings than I can remember. Store clerks, associates not using face coverings. I'm not sure why. This includes grocery stores, food handlers, workers. We need someone to explain the urgency of social distancing. So thank you for supporting the fact that we continue to message everyone that there's a stay-at-home order, that there is a curfew, that we are making recommendations about covering your face when you're outside of your home, particularly if you're in a retail setting, and staying home if you're sick, covering your cough, washing your hand, disinfecting surfaces. I almost have these memorized now. All right, let's see. We've had a couple of questions before about if the virus can travel in secondhand smoke, and someone asked if it can live in vape smoke, and the answer to that is complex. So if you are smoking or vaping and you exhale, yes, if you have infection, there could be droplets that you exhale that carry the virus on those droplets. So that would happen if you're vaping or smoking, and you're also touching your hands a lot when you're doing that, and maybe spreading it on surfaces. We don't think that the vape smoke itself can carry virus, across the room, or, if it's out of a car, into the next car. That's not likely happening. But if you do vape or if you smoke, be aware of the touching your face. Think that the many times that you touch your face, having not washed your hands, and also that you can, when you exhale, that there is potential for you to spread virus if you have infection. What do testing positive for antibody means? Okay, this has been a hot question lately because you've heard some of our city and county officials talking about antibody testing for first responders, and I talk about PCR testing for virus. So let me try to break that down a little bit for you. When you become infected with the COVID virus, soon after you become infected and start developing illness, the amount of virus in your circulatory system goes up very quickly. And so that's why these are the times that you can potentially spread that virus to others. So it's in your respiratory tract, it's in your nose, and when the virus is multiplying at a rapid rate early in symptomatic illness, the viral load goes pretty high, and that's why we use a PCR test to detect the actual virus that's circulating in your nasopharynx or your oropharynx, or things that are being expelled from your lungs. So that is a PCR test. It's based on the physical presence of virus in your mucous membranes. An antibody test is based on this molecule or cell that is produced by your body's immune system when you are infected. So initially you may see this rise in virus, and as the body has more virus, your immune system will begin to produce two types of antibody cells, type M and type B. G. IgM and IgG. So it's one antibody is called G. That's the one that's slower to be made by the body, but it lasts a lot longer. And IgM, or antibody M, that's the one that starts being made just a few days after infection but wanes over time. So if you get an antibody test and you were told, like this person was, that they were told they tested for 2 antibodies, that's both the short-acting antibody and the long-acting antibody that your body produced. That does not necessarily mean that you still have live virus in your system. The antibody test does not test for the virus. So if you have an antibody test, you would still have to have a PCR test to confirm that you have live virus in your system. So these are complex science things, and my husband sometimes tells me that I'm terrible about explaining science to him. So if this is confusing to you, please let us know on social media, and we will see if we can describe it in a different way tomorrow, and maybe use a chart so that I can show you exactly what's happening with regard to virus in your body and antibodies in your body. So again, the antibody test is not confirmatory for COVID disease. That does not count in our daily numbers. Only PCR positive tests count as a positive COVID-19. All right, we had someone ask if it's safe to handle delivery packaging, such as pizza boxes, food cartons, etc., during delivery or takeout. And so I had Brad, our inspection services program manager, write a reply to me, and he wrote a lot. Thank you, Brad, for giving me lots of information. Of course, we won't have time to go over all of that today, but I will read some of this. All guidance from the World Health Organization, the Centers for Disease Control, and the FDA still point to little risk through food itself and no reports or correlation to transmission by food or food packaging. There have been no known reports by any organization of COVID-19 transmission by food or food packaging. The biggest risk is still exposure to symptomatic individuals. And I really appreciate Brad putting this statement together for us, because it's very clear that the biggest risk is that you are potentially too close to someone who's handing you the food. Maintain that 6-foot distance, wear your face covering to protect yourself. There's no evidence to show that you could get COVID-19 through food or food handling. So thank you, Brad, for that. And this last one was also about food. So that's all I had for today. And let's see if we have anything on Facebook that needs attention today, or if that can wait till tomorrow.
The difference between recommend and strongly recommend?
Yeah. So James is asking what the difference is between recommend and strongly recommend. You know, when I come and talk to you all, it's unscripted, and I often have trouble finding the right words or using my words, but the strongly recommend discussion was lengthy, and the health officer and the mayor and the county commissioner all felt like this is something that everybody should be doing, but it is not a mandate. So strongly recommend means that our city leaders and our county leaders think you should be wearing a face covering anytime you're out in public, and particularly when you're in a retail setting where there are other people around that you may not be able to keep that 6-foot distancing. So the word was not should or shall, it was strongly recommend, because we believe that that's best for the community at this time. All right, so that's all for today. I'll see you again tomorrow at 2:30. Have a good day, everybody.